In terms of the split of the budget, do you see enough percentage going to the health sector vis-a-vis the 1.18 trillion they are putting for the build, and how the amount for infrastructure was actually spent in this current pandemic year?
I think given the requirements for us to manage COVID-19, I believe, what was that, 100 something billion peso budget for healthcare is not nearly enough. Perhaps it's enough to do the same thing that they were doing before, but then 157 billion in the midst of a pandemic, that kind of spending is not going to be enough. Now, we need to look at where the DOH budget is going. If it is only going to the previous operating expenses and then bringing in some additional healthcare workers, I'm not sure that will be enough to manage the COVID-19. In fact, I believe that during this pandemic, healthcare and economic relief fund should be the top priorities of the government budget at this time. But then that is not exactly so. We continue to do build spending, but then I thought last year they were talking about resetting, recovering, and bringing the country back to where it was before the pandemic. Obviously, the budget did not do that. And so, how are we going to achieve recovery? I think this budget is being labeled as the legacy budget. I don't think they should talk about legacy when the people are talking about getting back on their feet. No, we are not talking about legacy here when people are out of work, when businesses are closed, and the government spending program is under scrutiny by no less than the state auditors. And I think that will present a major challenge for the government to defend its budget in Congress.